Sierra Leone is a country that has witnessed over a decade civil war. It has been struggling with its economic, social, infrastructural development, with much more to be done in many other areas. Its president, Anis Bai Koroma, and its people are working hard to ensure the 8th Millennium Development Goals are met. In the midst of this effort, the country is hit suddenly by one of the most feared and dreadful viruses, Ebola. This virus has not only claimed the lives of medical practitioners, including doctors, health workers, and peaceful citizens, but has also affected the effective running of the state. In a state of public health emergency, the president ordered a 3-day stay at home from the 19th to the 21st of September 2014 to help contain the disease. The Ministry of Health, World Health Organization, civil society, and other organizations are joining the fight. The United Nations Entity for Gender Equality and the Empowerment of Women, UN Women, is one such organization that played its part during the 3-day house-to-house campaign. Since it was formed in 2010, the UN Women has been working for the empowerment of women with a focus on gender equality. The organization is working to achieve gender mainstreaming into the National Ebola Response Plan. With an inspired global action on gender equality, the UN Women Executive Director, Dr. Phumzile Mlambo Nguka, is bringing together new energies and talents, encouraging men and women to join in this shared endeavor. UN Women Director of Program Support Division, Golden Tokos Koslet, is a pillar of strength to help close the gap in gender equality. The UN Women Regional Director, Dr. Josephine Odera, is also a figure of hope and strength for women across the region. As Ebola continued to ravage and shake the very foundation of peace and stability in Sierra Leone, the UN Women representative, Dr. Mary Okumu, is with the staff in McKinney during the 3-day to help sensitize and ensure that data emanating from case management of admitted, discharged, diseased Ebola patients are aggregated. Thousands of youth are trained for this day to move from house to house, educating about the signs, symptoms, and ways Ebola could be prevented, with the message: avoid body contact and wash hands frequently. Throughout the 3-day, suspected cases were located and dead bodies were collected by the emergency burial team. During this time, a lot of chlorine was used to disinfect health workers, ambulances, and treatment centers.
When the outbreak of Ebola was announced at the United Nations country team, I was really quite surprised and sad, because the country has come a long way, became stable in its recovery from the civil war. And we know that this government has worked extremely well in putting the country back on a stability course. And so the declaration of the outbreak of Ebola in Sierra Leone was a very personal, sad moment for me. And in fact, I thought that we were going to be able to contain the disease rather quickly. The way Sierra Leone works very fast, very hard. I was very sure we were going to get it over with before it dragged its feet. And now we are at this critical moment where all the gains in development are being affected because of Ebola.
The UN Women is set to support the coordination, finance and logistics in gender planning and budgeting to ensure the necessary needs of women and men in quarantine situations are met.
UN Women, as part of the UNCT, the United Nations Country Assistance Team, is one of the agencies supporting all the pillars. We, at the UNCT, we have a platform for Ebola response to support the national emergency response on Ebola. That platform consists of WHO in the front line of the fight of Ebola. It has UNICEF, it has WFP, it has UNFPA, and then it has the other UN agencies that provide. Those frontline agencies in our platform are considered providing the critical response. We are working from behind to support the frontline agencies on looking at the gender dimensions on the impact of Ebola.
On the 1st of October 2014, the UN Women launched the Gender Mainstreaming Strategy for National Ebola Emergency Response in order to ensure that the capacities of women, girls, men and boys are considered equally in all aspects of responding to the Ebola outbreak. The technical officers and policy makers responsible for making decisions are providing technical support and guidance on adequate gender analysis, gender responsive planning processes at all levels. On the 10th September 2014, the United Nations Security Council unanimously passed Resolution 2177 on Ebola. Moijoy Kaikai is the Minister of Social Welfare, Gender and Children's Affairs.
Our government is fully committed to the full implementation of the resolution. It is important to note that Ebola response mechanism has a gender phase, and therefore every effort should be made to address the impact of the crisis as it affects more of women and children, especially girls in Sierra Leone. In Sierra Leone, the Ebola epidemic is having a particular negative impact on women, as the disease has claimed more lives of women than men. Ebola has killed over 50% as compared to about 45% men. Women and girls have been exposed more because of their gender roles as caregivers in the family and the community. My ministry is working with our partners to alleviate the social and economic burdens of the infected and affected families.
The First Lady of the Republic of Sierra Leone, Madam Sia Nyama Koroma, says she is sensitive towards the integration of gender perspective into the Ebola response strategies.
The current Ebola virus infection is affecting all aspects of human life in the affected households, communities, and countries. Perhaps following the civil war in Sierra Leone, nothing will be more devastating than the outbreak of the Ebola virus disease in Sierra Leone on May 24, 2014, the 25th known outbreak of Ebola virus in the West African sub-region. In the context of Sierra Leone and in the light of the outbreak of the Ebola epidemic, the United Nations country team has selected to focus on the thematic area of health. More specifically, the campaign is organized around ensuring maternal safety and access to adequate health services in the context of Ebola. As far as the Ebola virus outbreak is concerned, the historical evidence demonstrates the vulnerability of women and girls. The launching of the UN Gender Strategy for Ebola Response in Sierra Leone as well as the Beijing Plus 20 campaign today, is an important milestone in addressing the gender dimensions of Ebola. Therefore, my singular honor to officially launch the Beijing Plus 20 campaign in Sierra Leone, and I hope to closely follow this campaign as a measure of evaluating the effectiveness of the UN gender strategy for Ebola.
Mainstreaming of gender into the UN country team targeted response to Ebola in Sierra Leone will be achieved through the Gender Dimensions Cluster, which is set to work also with the UN country team Gender Working Group and the Gender Technical Team under the leadership of the UN Women as lead agency. Launching the strategy, UN Resident Coordinator David McClacken-Carr pledged his full backing and that of the UNCT to the gender mainstreaming strategy.
The outbreak of Ebola poses great challenges in Sierra Leone and across West Africa. Together, in the UN, we're adapting and rising to the challenge of Ebola in this country to support the government and the people of Sierra Leone. The challenge is so serious, ladies and gentlemen, that the UN Security Council has authorized for the first time ever the creation of the first health-keeping mission, UNMEA, which is the UN mission for Ebola emergency response. Gender mainstreaming is the process of assessing the implications for women and men of any planning action, including legislation, policies and programs in all areas and at all levels. The objective is gender equality.
The Deputy Minister of Social Welfare, Gender and Children's Affairs, with the support of the UN Women, recorded an album of 8 songs to help sensitize on Ebola.
Women must stand up to fight against Ebola. I worked with UN Women because I spoke to Madame Okumu about the role of women, and she was very inspiring when she said a lot of things about the role that women played in ending the war. And she said to me, women can play an even bigger role in ending Ebola. And so I worked with them, and they sponsored everything, and we recorded in the studio 8 songs. The big part of it is social mobilization, social awareness, sensitization, campaigning to people, telling them that prevention is better than an attempted cure of Ebola, so that's what we've been doing, and that's what I try to do in the song, and I also try to entertain them in the music as well. And UN Women is one of our pillars. They are one of our partners that we're working with to make sure that these things happen. So they were very happy, and they've been supportive of me every step of the way in doing this.
UN Women supported the house-to-house campaign, which was meant to sensitize the public, but literally go house to house to provide education, to provide the soap, and to just reinforce the education on infection control, preventing transmission from person to person. So UN Women went to 2 districts, Kailahun in one team, and to Bombali district, the second team. I was in the second team that went to Bombali to join the UN and the government in this extremely important sensitization exercise that lasted the 3 days. And in Bombali, in all Bombali and Kailahun and all the teams that went out to support this exercise worked through the Emergency Operations Center at the district level. Even we were involved in packing the house-to-house campaign materials, and we would then sit with the different pillars when they returned to be able to debrief on what went on in the day. It was a big success. The house-to-house campaign, I think, was very important because when we did accompany, for example, the surveillance team, the education team, there were different concerns. The rumors about Ebola are moving faster than the response. And this, I believe, is because people are still in denial. The UN Women was part of the house-to-house survey on the impact on food security under FAO. The results are negative. The economic impact of Ebola have been established. Schools are closed, and so we are bringing the need for the responses to take on the gender dimensions of the impact of Ebola. We want social mobilization activities to target women as caregivers, women as traditional leaders, women as victims, as patients, have a very particular role. And this is not just any other disease, it is deadly.
The scourge of Ebola continues to take precious lives in Guinea, Liberia, and Sierra Leone. Every day, confirmed cases are diagnosed, with women and children suffering the most. The fight is on. The battle must be won as the UN Women presses on.